Hello, I'm Dr. Chuck Kylo, and I'm the medical director for Touchmark. I've had the privilege of working with Touchmark for several years now and working fairly intensively with the organization since the beginning of the pandemic. I'm a general internist, so I trained in internal medicine and I also trained in infectious diseases. And so this past year with COVID has been a very interesting experience from that perspective. I also run Greenfield Health, which is a primary care group in Portland, Oregon. And we serve several of the Touchmark communities here in Portland. Today I want to speak a little bit about COVID and the COVID vaccine as the organization makes a push to try to get additional employees vaccinated against COVID. And I want to talk a little bit about that and why it's so important. As we know, this is a very dangerous virus, and since the beginning of the COVID pandemic, approximately a year and a half ago, the mortality rate has been not insignificant, and those who get infected, some significant percentage of them are having complications such as the loss of taste and the loss of smell. As these deaths kept mounting, this led to concern, but we were very fortunate to have 3 vaccines developed, one by Pfizer, Moderna, and one by Johnson & Johnson. These vaccines are highly effective at preventing COVID, although they don't prevent it completely. They prevent most of the complications and most of the deaths from the infection. Unfortunately, as the virus was spreading around the world, the Delta variant and other variants, Delta being most dangerous right now, came into existence. This is a common thing to have happen with viruses which spread so rapidly that mutations can develop, and these different mutant strains can come into existence. So Delta is the variant we're dealing with right now. The clinical disease is very similar to what we saw with the earlier virus, but the infectivity, the rate of spread of the Delta variant is much, much greater. So in the past, the majority of individuals being infected and having complications were older, but with the Delta variant, 50% of the cases are in those who are less than 50 years old. This virus is highly infectious. It's equivalent to chickenpox, which is really one of the most infectious and easy to spread viruses that we know of. So that's really important to understand. And these things all make us want to help protect you, Touchmark employees, your family members, and those that we serve, the members of Touchmark communities, to the optimal extent, and that really includes vaccination. So vaccination is really critical to reduce the harm that is done by the COVID virus, including the Delta variant. In addition, vaccination reduces the spread from individual to individual. Importantly, individuals can spread the virus, and Delta is spread for those who are infected for a longer period of time than the earlier virus was. And so vaccination is really important to reduce the rate of spread of the virus also. Now, some people believe that they had the natural infection to COVID and therefore they're immune. And while in fact they are immune for a month or two after the infection, that immunity has been shown to be very short lasting. So from that perspective, immunization is still critical even in those who had clinical infection with the COVID virus. So we would encourage everybody, irrespective of whether they had the vaccine or not, to get the COVID vaccine. Our goal is to achieve herd immunity, and herd immunity occurs when a sufficient percentage of individuals in the community, the herd essentially, have vaccination. And once that occurs, the rate of spread in between individuals falls sufficiently to thwart the spread of the virus amongst the community. That rate has to be fairly high to achieve herd immunity, particularly in a virus that's as infectious and spread as easily as the Delta variant is. They're going to edit this, so I'm going to just take a quick break here. We know that the vaccines against COVID are safe in those who are 12 and older. There have been a lot of studies and millions of people vaccinated. And to date, the rate of complications or adverse effects of those vaccines is very, very small. So the safety of this vaccine is really substantial. And so concerns about adverse effects really are not a reason why one should avoid getting vaccinated. There are religious and medical reasons, but in fact, the medical reasons are relatively small. There really is almost no reason that an individual should not get vaccinated. If you have an immune problem or you had recent chemotherapy as an example, you might respond at a lower rate to the vaccine, so you might not develop the same antibody response, but that is not a reason not to get vaccinated. People with medical conditions and things of the sort do not have a higher rate of adverse events, and you cannot get an infection from this vaccine. So this is not a live virus as a part of the vaccine. So infection is not one of the complications. Recently, more than 50 medical organizations came together in unison to recommend vaccination for all Americans aged 12 and older. This includes the American College of Physicians, which represents internal medicine physicians. It represents the American Academy of Pediatrics and the American Academy of Family Physicians. These groups, including many of the specialty organizations, all recommended vaccinations for all citizens. I do applaud Touchmark and their efforts to help employees and all residents to be vaccinated. I think this move is critical for your health, for the health of your families, for the health of your loved ones in your communities, and the members and residents of Touchmark. So I encourage you to participate and to work closely with the leadership of Touchmark to improve the vaccination rate across Touchmark communities. Thank you very much.